Hello, ladies. Thank you very much for joining today in this valuable webinar class on how to naturally reduce uterine fibroids. So, of course, this is very common. I've had more and more cases than I did in the past. I'm not sure if it's become more common for women during their childbearing years. Over the years, I haven't looked into that research, but on a personal level, I've definitely seen an increase in cases over the last, say, 10 years. So we're going to cover today the types, the causes, the signs and symptoms that a woman would face, and then, of course, some dietary guidelines, some home remedies, and some herbal remedies. Now, the good news is it's very manageable. See, I use the word manageable. Manageable means we stop the growth, we reduce the bleeding, the pain, the cramping, the pelvic hip pain, and all the other inflammatory aspects of this. The second stage, of course, is to reduce the size of the fibroids, and that does take more time. I found that this is a very tricky condition for a few reasons, because just dietary guidelines and home remedies do not seem sufficient. Most women have come to me and already have been working and struggling with this condition for an extended period of time. And of course, there's other options besides this natural way, including surgery. But for those who wish to avoid the surgery and are not the fibroids are not too large, too numerous, then of course this method is very effective. Of course, the sooner you see these signs and symptoms and have an ultrasound or a MRI done, and you see these or identify or diagnosed with these uterine fibroids, the better. The sooner you treat it, the better. Unfortunately, many women ignore these signs and symptoms and allow it to progress for a few years, and then they get the diagnosis. And then sometimes they delay on surgery, are not aware of the herbal remedies and what can be done, don't change the diet, and then it further progresses, and then they feel compelled to do the surgery. This seems to be the typical pattern, and I'm hoping that this webinar and class can help educate women to understand these signs and symptoms and motivate you to address the fibroids and the inflammation involved sooner. That said, let's talk about the different types of fibroids. And, we have the fibroids in the uterine wall, or the outer wall, we could say, or layer of the uterus. Then we have fibroids in the muscular layer of the uterus, and then the more rare type is when they're in the innermost layer of the uterus, protruding inside, which is rare. Now, that's not that important for this type of treatment, their location. What is more important is the size and the number of fibroids, and that can be determined by your ultrasound or MRI. And of course, the larger they are, the more obstructive they can be in affecting other organs, and of course, affecting a woman's fertility. So that's what's very important, is really the size. The smaller they are, the better. And the sooner they start this treatment, which means they're smaller, the better. So what are the causes? Of course, the number one cause is hormonal imbalances between testosterone, estrogen, and progesterone. And how do you know if you have these hormonal imbalances? Well, of course, you can get lab work done and have these measured, but premenstrual syndromes prior to menstruation generally will reveal this imbalance. Now, that's a large subject. I've given many talks on premenstrual symptoms and how to treat them. And there's many symptoms. And there's many treatments for each of the different symptoms. And some of these can be related to lower estrogen, higher estrogen, lower progesterone, higher progesterone. So in Ayurveda, we look at the symptoms because we don't have the blood work. But if a woman has blood work and we have the symptoms and signs and symptoms, then we can determine the hormonal imbalance, and we can treat the menstrual cycle and avoid long-term hormonal imbalances, high estrogen really, that can lead to the growth of fibroids. So often women don't take these menstrual symptoms seriously and just become used to them, part of life. We're talking cramping, breast swelling, mood swings, maybe irregularity of the menses or excess bleeding, and of course, many types of pain in the uterus and pelvic area. And, often women take aspirin and just kind of block this pain out or take a day off of work. But in fact, I would encourage all women to try to improve their menstrual cycle so it's as regular as possible with as minimal symptoms as possible, including mood swings, depression, and cramping as such. And that is another subject, but I would encourage that. And of course, I can help you in that regard. And most, if not all, of the treatments in that area are herbal and very effective. I have many, many testimonials. If you go to my website under PMS conditions, one I received recently, a woman did not have her menstrual cycle for 26 years and even did, I think she called it pelvic, hormone insertions. And I hadn't even heard of it. And of course, hormonal therapy. And she'd tried many things, even flown around the country. And within 2 months of just taking the herbal medicine, her menstrual cycle returned. And of course, I have many cases that are like this, women who are depleted and undernourished. Often their menstrual cycle stops, or they've been on birth control for an extended period of time, their menstrual cycle stops. And herbal remedies have been very effective in bringing these back. Of course, the longest I've ever had is this one woman recently, 26 years. I think the testimonials even on the, the ad for this webinar, because it's so impressive. So that is the number one cause of fibroids, is this hormonal imbalance. Number two is overweight, which of course also can lead to higher estrogen levels, less exercise, inactivity. And another one we don't think about is low thyroid levels. This is your T3 and your T4 levels. So if you're overweight and you have low thyroid, then your probability of forming fibroids is much higher. And of course, a woman who's never had a pregnancy and is in their, say, late 30s or 40s, probability is also higher. What are the signs and symptoms? Of course, many women who've had endometriosis and inflammation of the uterus or fibroids know many of these symptoms, abdominal pain, pelvic pain, and of course, the most common, heavy uterine bleeding, or we could say prolonged uterine bleeding after the menstruation. So if a woman is used to say 5 days of menstrual bleeding and 2 are heavy, and now she starts to have 4 or 5 heavy days, maybe the number of days doesn't increase very much, but the number of heavy bleeding days is what is the key indicator. So, and every woman is different in this regard. And there's many factors that are in play to determine how much bleeding a woman has during menses. But what you want to look for is an increase. If you're used to 2 days or 3 days of heavy bleeding and it increases noticeably, this is one of the most important signs. And even you can have more spotting, irregular menses, particularly coming early, heavy bleeding, pain, spotting, and of course, other symptoms can include, painful sexual intercourse. Even it can affect the bladder if they're getting large enough, and can contribute to frequent urination and even constipation, and ultimately miscarriages and fertility. And many people wonder whether genetics has a play. Of course, we all inherit a genetic disposition from our parents, but I give it very little weight because it's maybe just a disposition that you may want to be more concerned about. But dietary factors are a big issue here, and we're going to cover that next. So the dietary changes, and Ayurveda, of course, they see this as a kapha pitta condition. Kapha pitta means the kapha there's accumulated blockages have accumulated, just like with all, not just uterine fibroids, but cysts. You can have cysts in different parts of the body. You can have tumors in different parts of the body, even polyps. These are all in similar category, and they're all in Ayurveda considered, kapha conditions. This means blockages and the accumulation of tissue. Now, of course, we know that it's the cells start multiplying too fast and start making this type of fibroid cyst or non-malignant tumor. So we look at it from a cellular point of view in modern times, but traditionally it's just seen as blockages and accumulation of tissue. So there's a blockage element here. That's why you see overweight people, constipated people, inactive people, women who are not keeping their circulation going, keeping the body moving, and having other blockages like lymphatic blockages, constipation, such. So when you start to have these blockages in the body that you're aware of, like circulation issues, your feet can be cold. That's a lymphatic blockage. You can see cellulite and clotting take place, or even varicose veins are forming. This is a type of blockages that are taking place in your circulation and your lymph. Swelling on your lymph glands, even constipation, dry, hard stools, and not coming out. So these are all signs of blockages in other systems in your body. But when you start to have blockages in multiple systems, then you can also assume there's blockages in the female reproductive system. So the first stage, of course, is this blockage. And this blockage is creating accumulation of tissue and creating ultimately the fibroid. And then it becomes inflamed and sensitive. And this is when the pain starts coming, the excess bleeding starts coming. So we have 2 stages of formation, and we have 2 stages of treatment, which are in reverse. So the first stage, we're reducing down the inflammation, the bleeding, and the pain. Second stage, which is the longer stage, we're reducing down the size of the fibroid. Now, a lot of women, I treat them initially for the pain and the bleeding and the inflammation, and they're very happy and they disappear, and they do not continue with the reducing down of the fibroid because they have no longer any symptoms. And I do say this to women: you need to, just because you have no more pain and bleeding doesn't mean the fibroid has disappeared, or fibroids have disappeared. They may stop the growth, but it takes time for these type of growths to reduce. So you have to continue the treatment. We're going to talk about the treatment in a minute. So understanding this is like a kapha pitta issue with the blockages, also due to high estrogen. So estrogenic foods, estrogenic substances, even some chemicals and plastics can increase estrogen, as we know. But just reducing estrogen levels is insufficient treatment. We often see this with tumors where the people are just focused only on reducing estrogen. Of course, excess estrogen, estrogen dominance, low progesterone can contribute to this condition. But just stopping all estrogen or increasing progesterone, I don't feel is sufficient. You're not really addressing some of these root causes. So first the herbs work very well, but we have to understand these root causes. And every woman is slightly different. Some women have a lot of pain and a lot of bleeding and not many large fibroids. They're just very inflamed. This would be more like a pitta vikriti type of case, vata pitta or pitta vata type of woman. Other type of women are more kapha dominant, and they have very large fibroids, but very little pain, and maybe even not much excess bleeding, maybe just a dull plain, little bit more bleeding than they used to have, and it's more unnoticeable, but the fibroids can be much larger. So there is this difference between the size of the size of and number of the fibroids on one side you have to understand, and that's why the ultrasound is very valuable to have that information. And then the second side to diagnose is the amount of pain and inflammation, which usually accompanies excess bleeding. And every woman is different. Some women have a lot of bleeding, some women have a lot of pain, and others have very little. And some women, they don't even know they have the fibroids until the ultrasound. So every case is different. And since these are the two aspects of the treatment, reducing the inflammation and pain and the bleeding and supporting the uterus, and then ultimately reducing the size of the fibroid, then the herbal remedy has to change. But if we talk first about the reducing of the fibroid, the kapha side, then we're generally reducing down the protein, the animal protein, particularly beef and chicken that isn't hormone free. We're doing two things with this, getting rid of beef and chicken. One, we don't need this extra protein because this is contributing to excess growth in the body. And two, most of our beef and chicken is injected with estrogen to make the animal larger. So generally, I just take out all beef and chicken, let them have some fish. At least we know the fish are not injected with estrogen. Of course, it's another subject about farm-raised fish is not healthy. But so this is the first thing, and cheeses, same issue. Organic ghee and butter usually is not a problem. If the person's very overweight and heavy and the fibroids are big, then you can reduce all animal protein, fish, chicken, everything, and go down to a vegetarian diet of beans, and other vegetables, and even less grains. But if a woman is not overweight and thin, then she's going to need some animal protein to not be too depleted, and then we just leave it at fish and very carefully chicken without hormone-free chicken, but no red meat, no lamb, no pork, no beef for both sides. So, and we also reduce down the almost all dairy because of the kapha building, congestive, blocking qualities of it, and the fact that a lot of dairy have estrogen traces in it. But it would depend on the woman, the size of the woman, and how overweight they are, and are their actual weight, and the size of the fibroid. So the larger the fibroid, the larger the woman, the more strict we're going to be at this diet of this kapha reducing, these animal protein reducing aspect of it. Because if the woman's large and the fibroids are large, then we want her to shrink and the fibroids to shrink together. It's actually more tricky if the woman is thin and possibly underweight or depleted, because then we have to be careful she doesn't lose weight or become depleted while we're trying to reduce the size of the fibroids. In that case, we depend more on the herbs than on the diet to do the reducing. So the other side of the treatment is the reducing the pitta, the inflammation, the burning, that's experienced. And in this case, of course, it depends again on the case. If the woman's got a lot of bleeding, even spotting, and then we're going to take out all hot spices, even ginger and black pepper, and even tomatoes, particularly if she has a pitta prakriti. we're going to take out all the nightshades, all the hot spices, all the ginger, because we know ginger and black pepper, it thins our blood. All these things that we're using, even turmeric, to thin our blood is what we don't want for a woman who's spotting and having heavy bleeding. And then we take out anti-inflammatory things like coffee, chocolate, white sugar. These are all inflammatory. So we'd remove those. And of course, the more pain and inflammation a woman has, the more strict we're going to have to be there. Now, if there's very little pain and no heavy bleeding, then we can be more relaxed in this area, and the person could still have pepper and ginger, but we would take out the hot chili peppers and the very hot spices, no matter what. So there has to be this first adjustment in the diet based on the individual woman, as all treatments must be. This is the big fallacy that people have about diets and why there's so many diets that I can easily call fads. All diets are fads. Even a diet for fibroid diet is to some degree a fad, because you are a candida diet. These are fads because every individual is different. So I can't tell you one diet that all women could do for fibroids. So like I said, if a woman's heavy, I may let her have pepper and ginger and no animal protein at all, and she'll lose weight, and a little pepper and ginger won't hurt her. But if she's thin and depleted and having heavy bleeding and pain, and her body is warm and she's having other signs of body heat or an inflammation in the joints as well, then we're going to be more strict with the anti-inflammatories and more strict with these hot spices. And there'll be no pepper and ginger and even tomatoes involved, not even sour things involved. So again, you have to understand the concept of what you're trying to do with a diet and not think of giving everybody the same diet or think that it's possible to go online and read the perfect diet for you. You need to make this adjustment. And the same goes for the herbs. Like I said, I don't really see this treatment as possible without the herbs. And fortunately, women have been having uterine fibroids and the symptoms for thousands of years. So Ayurveda has already created treatments for them. I'm going to cover the home remedies in a minute, but I just want to get to these herbal remedies. So the first phase, if there's pain and bleeding and inflammation in the uterus, kind of like endometriosis, even without fibroids, then we use this very famous formula called Pushang Churna. There it is. See, Pushang Churna. It's made of 29 herbs. We import this from India. We call it uterine anti-inflammatory formula. We use it for basically excessive uterine bleeding, spotting, which, and in case fibroids, ovarian cysts as well, and even just painful periods, and of course, endometriosis, which is what this is really for, inflammation in the uterus. It's just there's different causes of inflammation in the uterus. So this is taken often before meals, and sometimes accompanied with aloe vera juice as the anupana. Very, very effective. Very, very effective. And like I said, they had this condition thousands of years ago, and they must have worked on this formula for hundreds of years because it is still working great today. So that's the first stage. Get this inflammation down, all the anti-inflammatories, the sugar, the chocolate, the coffee. If people think chocolate is healthy, but it's inflammatory. People love coffee, but it's inflammatory. Well, green tea is not. And then the second stage is to then reduce the size of the fibroid. And like I said in the beginning, many women are very happy with the first stage. No more pain, no more bleeding. Everything feels fine. Menstrual cycle even returns. If she has excess bleeding, sometimes I mix it with this formula instead. If the bleeding is really heavy, she may have to do this formula first. There it is. And you can see the first ingredient is still Pushang Churna, but then we have some cooling shatavari, ashoka, and lodra, which are both astringent herbs. So this one, and guduchi, which is anti-inflammatory. So this one is really more for more pain and really heavy bleeding. and irregular menses. Sometimes I've just combined the two together, and that's really what this is it's a version of this one because it has Pouchon churn in it. So usually I pick one of those two, and sometimes I even combine them together. And then once this doesn't take very long, I mean, just a week, couple weeks, the pain, inflammation is down. Like I said, many women, of course, thank me, give me testimonials, and disappear. But they shouldn't. They need to keep going because the fibroids are still there. We've just brought the inflammation and pain down. So then we need to move forward and reduce them. And we do have, I can make an herbal formula, but we do have some pre-made formulas. Uterine fibroid tea. And, as it says there, it helps, reduce estrogen. It's a uterine tonic and reduces some of the PMS symptoms and reduces all types of uterine fibroids slowly. Now, if we look at these herbs, we know red raspberry leaf is a uterine tonic. We know chaste berry is also a hormonal balancer, and it will not increase estrogen. There's no estrogen qualities to these herbs. They're just helping the reproductive system of a woman to find the right balance. But chasteberry is one of the best for this condition. And dandelion root and milk thistle root are, mostly related to the liver, but they do help in this case in reducing the fibroid dong quai. And black cohosh, not blue cohosh, is used here. Again, helping to reduce estrogen and balance the hormones and reduce the fibroid down. And usually we'll combine it with one of two formulas here. The other formula an Ayurvedic doctor would give you would be Kanchnar Gugulu, and we call it growth reducing tabs. This is for fibroid swelling, stiffness, joint pain, and it doesn't even say on there, but it says growth, so that would include tumors. This is Kanchnar Gugulu. It comes in little tablets. It's quite powerful. We have it in, it's many, many herbs in there. And so that would accompany it. These two would go together to reduce that down. And a woman would have to do 3 to 6 months minimum. I generally let them go 3 or 4 months. And, you should try to feel the fibroids and feel that you cannot feel them. They're getting smaller. And then go in and get another ultrasound. Now, sometimes I use this one instead. This is called Chandraprabha, another formula called Chandraprabha, even more herbs in there. It doesn't say it's made for fibroids, but this is for a woman that, because I know the herbs, it does have some gugulu in it, which is similar to Kanchnar Gugulu, but it's more cooling. Kanchnar Gugulu is very hot and strong, and it's made to break up fibroids, but sometimes that's not what you want. You can't give something too hot to a woman. So I use Chandraprabha. Chandra means cooling. Now, when the treatment's all over and the fibroids are small, usually we want to balance the hormones. And particularly if the fibroids are shrinking and the woman wants to be pregnant, then we would start the female health support, which is going to help the most with the hormones. And if you've studied Ayurvedic herbs, there are the big three hormonal balancers there. Shatavari, which is a cooling, sweet female reproductive supporting herb. Ashoka, which basically means friend of woman, even though we can use it in other areas. And Lodra. These are textbook female hormonal balancing herbs. Very nice, sweet tasting formula, by the way, not tasting bad like the colon formulas. And that's kind of like the recovery phases of the treatment, the third stage. We also have other Shukramara, Grita, which we call menstruation ghee, sometimes will be used in this third phase as well if the woman has still cramping, pain, and a dryness, particularly vaginal dryness. And then we use the herb, it's actually coming in ghee. And many of the same herbs, Ashoka, Lodra, Shatavari, are in here. It's just in ghee. So it's a better for a vata depleted type of woman who's dry. And this so those are the three phases: inflammation and excess bleeding is reduced. This is very quick, couple weeks, month at the most. Many women have not done even more than a jar or two of the uterine anti-inflammatory. And then the second stage is, of course, the long stage, reducing down the fibroids. This can take 6 months, even longer. And then the third stage is the recovery, where we're just supporting the reproductive system. I may give PMST. I may give female health support. Many other formulas would be there that would be more under the category of fertility. So that said, there are two good home remedies left. One, flax seeds. Having flax seeds every day. Flax seeds are known to help balance hormones, particularly reduce estrogen. And the most important, and flaxseed oil, 1 teaspoon of flaxseed oil every day helps with pain and can help balance and lower your estrogen levels. Not by much, but it's all helping together. It's the combined effort, the right diet, the proven herbal remedies, and a few home remedies. But here's the most important home remedy, and that is castor oil. Castor oil pack. Now, this one is here on my desk because it's made for, internal use. So there it says purges and cleans the GI tract. Take a couple tablespoons before bed and some ginger tea or peppermint tea. But in this case, it's a castor oil pack on the uterus. Not sexy, stinky stuff. But anyway, you got to get these fibroids down. And a woman should lie on her back, and she should make an effort to identify and feel where these fibroids are in her uterus. And particularly if they're painful, they're easier to find. And if they're big, they're easier to find. So the more advanced the condition is, the easier they are to find in a woman. And then she should become familiar with where they are and the size and the sensitivity and the tenderness of how they feel. Then she can start the treatment and put on the castor oil. Castor oil should be a little warm. You just get like some gauze, put the castor oil on it, put it right over the spot that you feel it on your uterus, and then put on like some tight spandex type of underwear to hold it in place and overnight, and then remove it in the morning and repeat. This is not quick. You'll have to do this for months, but it really speeds up the whole process. So, changing the diet, getting rid of these kapha increasing foods, meat, cheese, eggs, to some degree, depend on your body weight and the size of your fibroids, getting rid of all these anti-inflammatory things. And of course, there's no junk food, fast food, processed food. This is all it has to be eliminated no matter what. And of course, in many conditions, it has to be eliminated. But, this can be a cause. Most women who've had fibroids, majority of them were eating junk food, fast food with the saturated fats, and had many other symptoms of poor liver function as well. So sometimes we do treat the liver as well. And sometimes we also have to treat constipation as well. And sometimes, there's inflammation systemically through the whole body, not just the uterus. So we have to treat inflammation more systemically. And sometimes when some women even have so much inflammation in the uterus, they also have in the bladder, which creates excess urination, in the colon, which creates a type of pre-IBS condition. So you may have to treat other aspects of and other systems in the body if there's really systemic inflammation everywhere, like inflammation in the colon, inflammation in the bladder, inflammation in the joints, then, and inflammation and pain in the uterus. So it wouldn't only be just these herbs. And again, these herbs have to come in stages. So the woman has to continue to go and take these products for some time. So I hope that helps you better understand the power of herbal remedies for treating uterine fibroids, the possibilities of doing this. I wouldn't really recommend people to just start purchasing these herbs and trying. Fortunately for me, after decades of experience, I've had a lot of feedback from women, and now I'm able to adjust for different types of women in different types of cases, because there's many variables. And some women follow the treatment and the diet very carefully, and so their progress is very fast. While other women, are not able to take the herbs fast enough, so their progress is very slow. So the important part from my side is to just know when we should move to the next stage, when I should recommend going to get another ultrasound, and maybe sometimes increasing the dosages or decreasing the dosages. And a woman can start off with, say, excess menstrual pain, and then we're giving her certain herbs, and then now she misses her menses. So all the herbs need to change at that point. So sometimes in the middle of the treatment, when the inflammation comes down, the symptoms of the menstruation completely change, even though she still has the fibroids. So that means the herbal remedies have to change as well. So even I start a woman off on the right herbs, it doesn't mean that 3 months later she's going to be on the same herbs. And so that's why you have to, it's a work together type of treatment to reduce these fibroids. But if you're young and you want to have a child in the future and avoid the surgery, this is the way, the recommended way. Of course, some women, they opt for the surgery, and that is, of course, their prerogative and choice. This is only presenting you with an alternative. You have to be motivated. You have to change your diet. You have to take the herbs. But remember, if you just do the surgery, you still have the great probability of just making more fibroids again and having the whole problem come back in a year or two, which I've seen. Many of my cases have already had surgery, and now they're coming back, and the second time they don't want to get the surgery. So that's an important point. Once again, thank you very much, ladies. Feel free to contact me if you like more information. I do offer a free 15-minute consultation if you fill out my paperwork so I can understand your condition. And of course, we have almost a full page of questions there just for the women. So it allows you to check off a lot of boxes, and I can understand the state of your female reproductive system quickly by looking at that page in my form. And then you can inform me about the size of the fibroids, what the doctor said, and we can take it from there. I can do this with you on Zoom and mail you the herbs. So let me know if you have further questions or you just like to talk. Feel free to contact my office or just schedule one of these free 15-minute appointments. You will be required to fill out paperwork in advance, so I have information. Or if you're convinced and ready to go, please go ahead. And I appreciate you sharing with other people. I really see this as a growing concern amongst our modern society of women. It seems to be increasing. So I've got very good at treating it, and I'm happy to help more women. Thank you very much.